Begin. Enter the room.
Hello.
Hi.
Well, I'm Bushra. I'm one of the doctors in this department for today. Can I confirm your full name and relationship to the child?
Yes, my name is Danielle Brown, and
Mhm.
I'm Rick's mother.
Your Rick's mother. Can you confirm his full name and age for me, please?
Yes, he's Rick Brown, and he's 3 years.
All right. Thank you for that. So I understand you're here for some concerns about Rick's vaccination. Is that right?
Yes, I'm actually worried about his flu vaccine, doctor. He's actually scheduled for, for it next week.
Mm-hmm. Okay, well, I'm surely going to help you out in that regard, okay? I
Mm-hmm.
understand that, parents can be a bit concerned about vaccinations, but don't worry, we'll try to help you out.
Okay.
So, what exactly are you worried about? Can you specify, please?
Yeah, well, you see, a neighbor's kid recently had, this vaccine, and he ended up getting fits after that. So I'm just worried about, whether it can happen again for my.
Mm-hmm. Okay. Yeah, all right, I understand. So, all right, so let me ask some questions about Rick's general health, and we will see what we can do from there, okay?
Sure.
All right. So can you tell me if he has he has been receiving his all vaccinations as of up to date? Or is his vaccination record up to date?
Yes, all his vaccinations are up to date. In fact, he got this vaccine last year as well.
Hmm. All right. So you got the vaccine last year. Did he had any side effects, any complications after that?
No, not really. I mean, he just had this mild fever, which kind of, subsided within a day or two.
All right. All right. Well, that's reassuring. Okay. So can you tell me a bit more about his general health? Does he have any long-term medical condition like asthma
Um,
or any? Mhm.
no, doctor, he's perfectly fine.
Okay, any wheezes,
No, doctor.
any allergies, particularly any egg, gelatin, or neomycin allergy?
No, doctor, nothing.
Okay, that's great. Any medications he's taking, particularly any steroidal medication?
No, doctor, he's not on anything.
All right. So, can you tell me a bit more about his birth? Was it a natural delivery or was it a cesarean section?
Yeah, it was natural. Everything was absolutely fine.
All right. And can you tell me, are you happy with the blood book
Uh, the red book? Yes, yes, he's doing great.
and his development is also good?
Yeah.
And he's feeding well, he's eating well.
Yep.
Hmm. At the moment, how is he doing? Does he have any fever?
No, doctor, he doesn't.
That's good.
Yeah.
Any flu-like illness or any diarrhea?
No, doctor.
Okay, that's great. Um, so, okay, so what is your understanding about the vaccine in general?
Yeah, I just know that, usually vaccines are given to prevent infections, but I
Yes.
don't understand this vaccine very much. It's given every year. I mean, he got it last year again. You want to give him this year and then every other year. Like,
Mhm.
why is that?
Yeah, so all right, let me explain it to you. So basically, the vaccine that we'll be giving him is it's a flu vaccine, and it is a live. Basically, what happens is a live flu bug is inserted in the body, all right, but it is weakened, so it does not cause any harm. It does not cause any flu-like symptoms. Okay, all it does is produce some antibodies, some cells that fights the infection if it happens later in life. Okay,
Okay.
does that make
Okay.
sense?
Yeah,
Okay,
but why
so
every year?
yeah, so I was coming on that. Basically, this is against a virus which we call as influenza virus, which is a flu virus. Okay, every
Mhm.
year, as the researches have been going on, and the vaccine that has been administered every year, it's not the same as the previous one. They have been making some changes in it. Okay, so they're making it stronger every year. Okay.
Okay.
All right. So moving on. All right. So apart from this, like, do you have any questions up till now?
Well, I just want to know, will Rick get sick after getting the vaccine?
Okay. Well, usually the vaccines does have some small side effects, and it's less likely that it can cause any serious harm, but it usually causes any, sometimes runny nose, fever, low grade, and it does get better after 2 to 3 days usually. Okay. Well, the
Okay.
vaccine is
If
administered.
he may get fit.
Yes, I understand you had that concern previously as well. It's highly unlikely that the vaccine can result in fit.
2
Okay,
minutes remaining.
as of now, there is no study that proves the relationship of fit with the vaccine. All right?
I see. So how do you
Yeah.
differentiate if he does have these, flu-like illness, how do you actually differentiate that it's come from the vaccine or from the flu, or if he's gotten a flu?
Yes, in case you do feel like he is after, he's been administered with the vaccine, and if you feel like he is getting it's just not well, if you feel like his fever is not getting better, it's really high grade, you have to come back to us. Maybe there's something else going on. We can investigate it at that time. Okay?
I see. I see.
Mm-hmm. Moreover, I'm also going to give you a leaflet about it, the NHS leaflet regarding the vaccination schedules, so you can read up about it for the next vaccinations as well, all right?
Sure, doctor.
Mm-hmm. So, did you agree with that?
Yeah. Well, is
Okay.
it compulsory to have this vaccine?
Yeah, well, it's highly advisable from our side to have it so that, it prevents any complications like infections of the chest or pneumonia, so serious infections. But again, it is your choice and it is not mandatory by the NHS, but it is highly advisable. Yeah.
Mm-hmm.
Okay. So
Yeah.
I will have you back on a follow-up. Um, if you have any kind of questions or concerns, you can always come back to me and I will explain to you anything that you do not understand. If you have any other questions or any worries, you can always come back to us, okay?
Okay. Sure, doctor. Yeah, absolutely. But I just have one last question. I mean, can a child ever catch flu from these vaccines?
Uh,
From flu
it's
vaccine?
highly unlikely that, the vaccine does not cause flu. It does not cause flu. And it's just the symptoms that sometimes there's runny nose and the fever, but it does
Move
not
on to the
cause.
next station.
Okay.
Dr. Bushra.
Mhm.
That was definitely that was good. That was a good attempt. Yes, good job. So one thing that I would like to tell you is that you mentioned something about the flu vaccine. Uh, you know, it's a live attenuated vaccine, and its potential of causing severe infection is low. But if you see, technically, the symptoms that actually do come up, it's actually flu-like symptoms only, Just that
So
the
it is
infection itself, it's
does that
very,
mean
huh?
does that mean it cause flu? It can because it was written that it does not cause flu. That's the definition. The
What
flu
about an
vaccine.
immunocompromised
Mm-hmm.
child? What about an
Oh
immuno?
yes, yes. It's an immunocompromised child. Definitely it can.
Asked a very general
Mhm.
question. Can it ever happen? So you can always, I mean, this always comes to the fact of if you have that, that presence of mind. I know this is like a high stake exam, and
Yeah, yeah, you're right.
I get you. Yeah, but definitely if such a question occurs, you can talk about, when are the causes when they actually do cause like a flu infection, full-fledged. Because in this case also, it does have a mild reaction, but that is basically the immunity of the child actually fighting against any, infection that could be caused, right? So potentially making more of those, fighting chemicals so that this infection doesn't happen again. But after administering, you will have a mild infection, like a very mild. Does that make sense?
Yes, yes.
But it has
So can
no
we say that
it
it
has no
can cause an immunocompromised patients?
major infection in a healthy child without any immunity problem. That is
Okay.
say. All right. So that is a warning that basically you're planning to give, and when to avoid it when the child is having any active infection, right? All right. Otherwise, it was a good try. Let's quickly look at the results. I think you did pretty good this time as well. I mean, the first time also was pretty good. So yes, let's quickly look at the results. I'll just share my screen. All right, look at that. Wow. So yes, this time you confirm the full name of the child, the mother, very good. You asked her the reason for the visit and asked about any recent symptoms, asked about the past medical history, especially any history of asthma or a recurrent wheeze. Yeah, so basically it kind of exacerbates it. All right, so you ask that question twice. And so again, there are a couple of questions that you're asking twice. I mean, it's not a I wouldn't say it's a bad practice. I mean, it's just, you know, taking a little more time than it should, right? So in the first go itself, you can ask, like, does he have any conditions, you know, with wheeze, like asthma maybe, you know? So it happens in one go. Right. So rather than asking the same question again, right? Are you happy with his Red Bull? Is he developing well? Right? In one go, right? Rather than asking it twice.
Okay, got it.
Ask about passing away, we spoke about that. Inquire about any drug history, particularly if the child is on any long-term steroids or aspirin. Explore any other allergy history, such as allergy to egg, neomycin, or gelatin. Inquire about pregnancy, birth, vaccination, development, confirm if the child has been meeting milestones normally, confirm Daniel's understanding of flu vaccine and Rick's health after his first flu vaccine and address specific concerns, assess general well-being, ask about feeding habits, growth, behavior, and weight gain, explain the nature of the vaccine, live attenuated. Yeah, I'll give you partial because over here you never mentioned the administration route, right? So you can actually ask also, you know, how was he given the vaccine before? Could you tell me about how he was given the vaccine, right? Since he's already had the vaccine, right? So you asked about did he have any issues after it? So that was good. Actually, that was actually some you asked that, right? Discuss the benefits of flu vaccine, prevention of complications like pneumonia, bronchitis, and ear infections, which are the infections that are caused by influenza virus itself, right? And highlight the vaccine protects against flu and other symptoms. Post-vaccine post-vaccination are mild compared to the normal flu infection. Discuss the potential side effects like you know, runny nose, blocked nose, headache, general tiredness, loss of appetite, which basically typically lasts for 2 to 3 days. Explain that it is a single dose administered nasally and is completely safe. Clarify the flu vaccine. That was practically the only point that you didn't speak about. So good job. Clarify the vaccine does not cause fit and there is no evidence supporting a link to such a severe reaction. Clarify common myths, address fears about seizures, fits, and assure that the side effects are very rare and usually mild. Highlight the importance of yearly vaccination due to change in the circulating flu virus strains. So there is something that I'm actually going to give you a partial for this because you said something along the lines that it makes the vaccine stronger. It does not make it stronger, it modifies it according to the strain which is present. All right, so the
Okay.
that happens is according to the prevalent strain at the moment. So you mean, what do you mean by making it stronger? Right, making it stronger, like how would you explain that? So basically the changes, they actually change the vaccine depending upon the strain that is prevalent at that time. So every year, so this particular virus has a tendency to change its composition so that it can avoid detection from you know, the body's immunity. So since this happens very regularly for this type of a virus, every year they change the vaccine in such a way that it you know, it provides immunity against the prevalent strain that is there at the moment. Yeah, does that make
Oh,
sense?
yeah, now I got it.
Yeah. So yeah. So if you're going to be using words like stronger, I mean it's very ambiguous, right? So yeah, just make sure to explain that a little bit more. Yeah. Ensure the non-compulsory but highly recommended nature of flu vaccine for children from the age of 2 to 17. Reassure regarding safety, especially in the context of previous vaccination and lack of risk factors. I'll give you partially for this. Offer leaflets about the flu vaccine and the immunization schedule. Good job. Provide safety netting. Yes, you did this one. And offer follow-up. That was also good. Otherwise, even management was great. So good job. That was really good.
Please like and subscribe to Turing Med School. Good luck with your preparation.